If you are waiting until your kid is 12 to think about orthodontics, you might already be too late for the part that actually matters. Not the part where you pick a color for the braces. The part where your kid's jaw is still forming, and once it is done forming, some problems can't be fixed the easy way anymore. Stick with me, this one's going to surprise you. Okay, hold on, before you picture a 7-year-old walking around with a mouth full of metal, that is not what I am talking about. I am talking about something almost nobody explains to parents. A checkup, a specific age, a window that has nothing to do with straightening teeth and everything to do with how your child's jaw actually grows. Most parents have never even heard this exists. Let that sink in for a second. Here is how it usually plays out. A mom notices her 6-year-old's front teeth coming in a little crooked. She mentions it at the regular dental checkup. Let's just watch it. The dentist says, "Kids' mouths change a lot. No need to worry yet." Reasonable advice. A lot of the time, that is exactly right. Baby teeth shifting around is completely normal. So she waits. Checkup after checkup, the same line, we're watching it. Nobody brings up an orthodontist, why would they? Nothing seems urgent. By age 11, her daughter's jaw has fully formed around a narrow dental arch. Her upper jaw is noticeably smaller than her lower jaw. The bite doesn't line up right. She is self-conscious about smiling in every school photo. Now the orthodontist is talking about jaw surgery down the road or years of complex treatment, instead of the simple appliance that could have gently guided that growth years earlier. If someone had looked at the right time. Nobody did anything wrong on purpose. The system just isn't built to flag this the way it should. Here is the truth. Most bite and crowding problems people associate with orthodontics, crooked teeth, gaps, mild crowding, really can wait. Watching and waiting is often the right call. But there is a specific category of problems that are different: jaw width issues, crossbites, severe crowding, and certain bite misalignments. These aren't about tooth position, they're about how the jawbone itself is developing. And jawbone growth has a timeline your dentist isn't always trained to catch early because it is a different specialty entirely. The American Association of Orthodontists recommends every child have an orthodontic evaluation by around age 7. Not because most 7-year-olds need treatment, but because that is when an orthodontist can still identify and often gently guide developing jaw problems while the bone is still growing and responsive. Nobody tells parents this recommendation exists. It is not part of the standard conversation the way vaccine schedules are. So why does this keep slipping past so many families? Reason 1. General dentists are excellent at catching cavities and tracking tooth eruption. But jaw width and bite development issues are an orthodontic specialty. It is simply a different lens trained differently. Reason 2. The visible problem, crooked teeth, doesn't show up until years after the underlying jaw issue actually started. Parents react to what they can see. The jaw problem is invisible until it isn't. Reason 3. There is a persistent myth that you should wait for all the permanent teeth to come in before seeing an orthodontist. That is true for a lot of straightening work. It is not true for jaw width and bite guidance issues, where earlier is often significantly easier and less invasive. None of this is anyone's fault individually, but it adds up to a huge number of families missing a window that costs nothing to check and could save years of complicated treatment later. I know what some of you are thinking right now. Great, one more appointment to add to the pile. Fair. So let's make this dead simple, right now. Here is exactly what to do and what to watch for. First, schedule a free orthodontic evaluation around age 7. Most orthodontists offer this at no cost, specifically because they want to catch developing jaw issues early. This is not the same as a regular dental checkup. Ask specifically for an orthodontic screening. Second, know the actual red flags. A crossbite, where the upper teeth sit inside the lower teeth when biting down, especially on one side, significant crowding where teeth are visibly overlapping. A jaw that shifts noticeably to one side when your child closes their mouth. Mouth breathing or snoring, which can be linked to a narrow upper jaw restricting the airway. Thumb or finger sucking that continues past age 5, which can actively reshape the palate. Third, Understand what early treatment actually means. It is often not braces. It is frequently a simple, removable or fixed appliance that gently guides jaw width over months, taking advantage of the fact that a young child's jawbone is still soft and responsive to gentle pressure. This is fundamentally different from adult orthodontic work. Fourth, if a dentist tells you to just watch it for something on this red flag list specifically, a crossbite, a shifting jaw, ongoing mouth breathing, get a second opinion from an actual orthodontist. Watching and waiting is right for a lot of things. It is not automatically right for jaw development issues. Write this down: an orthodontic evaluation at 7 doesn't mean treatment at 7. Most kids screened at that age don't need anything yet. But for the ones who do, this is the window where the fix is simplest. But here is the part that is genuinely hard to hear. Even parents who've heard exactly what I just told you still skip this. We'll ask about it at the next cleaning. It is probably nothing. I don't want to overreact. Stay with me, because what happens in the years between we'll get to, and actually getting to it is exactly where this problem quietly gets worse. Let's be completely honest with each other. Most kids do not need early orthodontic treatment. I want to be straight with you about that, because I am not trying to convince every parent watching this that their child has a jaw emergency. But some of you have noticed a crossbite, a jaw that clicks or shifts, a kid who still can't stop sucking their thumb at age 6. And you've been telling yourself it is probably nothing. I am not here to make you feel bad about that. Dental anxiety is real, appointments are expensive feeling even when they're free, and wait and see is genuinely the right call most of the time in general parenting. But here is what doesn't change: no matter how busy your family is, a growing jawbone only stays easy to guide for a limited number of years. After that window closes, the same problem often requires years of treatment, sometimes surgery, instead of a simple appliance worn for several months. This isn't about panic. It is about making one phone call instead of continuing to watch it indefinitely. Now here is the part that actually matters most. This is genuinely one of the easiest wins in your entire parenting journey, if you know to ask for it. A single free screening, no commitment. No pressure to start treatment your child doesn't need. You don't have to become a dental expert. You don't have to diagnose your kid's bite yourself. You just have to know that we're watching. It isn't the same as an orthodontist looked at it. Those are two completely different sentences, and only one of them actually rules out the problems that matter. The parents who get the best outcomes here aren't the ones who panic over every wiggly tooth. They're the ones who booked one simple evaluation before anyone told them they needed to. You just became one of those parents. If this video changed how you'll handle your kid's next dental visit, that was exactly the point. Go look up a free orthodontic evaluation near you. Most practices offer it starting around age 7, and it costs you nothing but 20 minutes. If you want more videos like this, straight talk about what actually matters in your kid's health, without unnecessary fear, hit subscribe. This channel exists to close exactly this kind of gap. Let me know in the comments, had you ever heard of the age 7 orthodontic guideline before this video, or is this brand new information? I read every comment, and it genuinely shapes what I cover next. One important thing before you go: I am not a dentist or orthodontist. And this video is for education, not diagnosis. If you have any concern about your child's teeth, jaw, or bite, talk to a licensed dentist or orthodontist who can actually examine them. See you in the next video.